Hello, and welcome to Insight Memory Care Center. We are excited to partner with AARP today and Dr. Hill at the Alzheimer's Association to bring you disparities in dementia care and how we can learn and support change. Our mission is to provide specialized care, support, and education for individuals in all stages of memory or cognitive impairment and their partners and the community. Our vision is a community where those living with memory or cognitive impairment and their care partners can achieve the highest quality of life. We are a leader in dementia care in Northern Virginia. We've been a nonprofit since 1984 that supports the families on their dementia journey. With CARE, we specialize in adult day programs for people at all stages of their dementia journey. We connect by building relationships and supporting care partners on their journey. And with our creativity and dementia experts, we share our knowledge and resources because every journey is unique. We can't do this without the support of families with generous donations and also grants. And one of our family members even said, I support Insight because I think this is one of the premier organizations to help people with dementia and their caregivers. I am extremely impressed with their staff and services provided. A couple of ways that you can help out Insight is either through your IRA or other gifts, monthly donations, or workplace giving. And twice a year, we do two large fundraisers, the Painting and Pairings at an Insight Gala and the Legacy Breakfast. You can learn more about these on insightmcc.org/events. Just some upcoming events to make you aware of. We have a Mind and Body workshop starting March 5th. Care partner training, Stay Steady, Understanding Aging, Cognition, and Balance and Gait on March 8th. March 16th, we're doing an Alzheimer's disease and dementia care seminar out in Sterling. And on March 16th, we are partnering with the Lewy Body Dementia Association and premiering the Spark movie at the Providence and Landing in Alexandria, followed by a Q&A. Now, without further ado, I'd like to introduce you to Dr. Carl Hill from the Alzheimer's Association. He is the Chief Diversity, Equity, and Inclusion Officer, overseeing strategic initiatives to strengthen the association's outreach to all populations and providing communities with resources and support to address the Alzheimer's crisis. In this role, Dr. Hill is responsible for developing cross-functional partnerships with organizations to advance diversity, equity, and inclusion. As a result of his leadership, the association has broadened its reach to previously underserved communities, with partners such as the Thurgood Marshall College Fund, National Indian Council on Aging, National Black Nurses Association, the National Association of Hispanic Nurses, and the African Methodist Episcopal Church, and the Buddhist Tzu Chi Foundation. Within the association, Dr. Hill collaborates with human resources to attract talent and develop resources that champion staff diversity and culture of inclusion. He authored an editorial in the Journal of New England Medicine, Neurology, highlighting the need for more diverse, representative perspectives to address disparities and pursue equity in dementia science. Dr. Hill previously served as the association's Vice President of Scientific Engagement, and prior to joining the association, he served as Director of the Office of Special Populations at the National Institute on Aging. Throughout Dr. Hill's 6 years in this role, he led the development of the NIA Health Disparities Research Framework with stimulate studies focused on health disparities related to aging. He also directed the NIA Butler Williams Scholars Program, which provides yearly training for early career investigators interested in aging research. Dr. Hill earned his Ph.D. from the University of Michigan School of Public Health, where he trained with the Center for Research on Ethnicity, Culture, and Health, and the Program for Research on Black Americans. He's an alumnus of the National Medical Fellowships, the W.K. Kellogg Foundation Health Policy Fellowship Program, and Dr. Hill holds a Distinguished Alumni Award in Master's degree in Public Health from Morehouse School of Medicine, and he received his Distinguished Alumni Award in 2019. As a member of the Center of Disease Control and Prevention's Public Health Prevention Service, a training and leadership program he helped to establish, the Center for Bioethics and Research in Healthcare at Tuskegee University. Without further ado, welcome, Dr. Hill.
Good to see where you work and to actually be in the community. I think that's really important. I spent a lot of time with the Alzheimer Association and chapters, so it's really good to be in the community here in Virginia. So we'll get started. So today I'm just spend a few minutes talking about the power of partnership in the pursuit of equity. We'll talk about what equity is for Alzheimer's and all other dementia. And I use that phrase quite deliberately, all other dementia, because that is inclusive. But partnership and just how, in my journey or how I have seen things come together, it's just been unforgettable that, partnership is so critical and moving things forward. So let's get started. So, I start with a story. This is where I began my career, my public health career. As Melissa mentioned, I was a graduate of the Morehouse School of Medicine's Master of Public Health program. I was in the first class. And if you could imagine, back in 95, way back in 95, there was a need for more representation, more diversity in public health. So, there was Black African American communities disproportionately affected by so many disease outcomes, but very few African Americans in the field of public health. And so some people got together, partners got together to create this new program in public health. And so you had people from Morehouse School of Medicine, academicians or funders at CDC, community leaders, all got together and said, we have to get a master's in public health program at an HBCU because that's going to guarantee that we have some African Americans in the field. And so I was able to witness that firsthand. That's me back in the back right, kind of hiding, making sure no one was calling me for any questions. But just had an opportunity to see firsthand how a partnership could lead to just this small first class with about 3 or 4 faculty, to begin to create change in this field. And so, keep that in mind. So the Alzheimer Association, our work is about community and science. Global organization, working to advance care, support, and research across the world. I'm sure you've seen this symbol before, but it represents science and how it translates to public health. How it translates to protecting brain health, providing support for families and communities that are dealing with Alzheimer's or another dementia. When we talk about diversity, equity, and inclusion, diversity is the numerical representation of differences. I'm kind of getting over the term diversity because I think we all can acknowledge the importance of differences. Equity, a little different than equality. I would think that many of the people in our community have a great respect for equality. People need, a piece of the pie. But equity goes a bit, farther than that to say we have to understand what people need, and inviting them as a volunteer to a community event. Not everyone may respond to a letter in the mail, or an email. You may need to go knock on their door, right? Or you may need to go and tell them about the availability of the vaccine or what have you. So really assessing how people can best receive resources, right? So if we think about diversity, diversity might relate to disparities. Disparities, we know African Americans are disproportionately affected by many outcomes, Hispanic, Latinos as well. Equity is how can we get the resources to people where they can really use it, right? That's so important. And inclusion is just being authentic. From the very beginning in all of our plans, prioritizing inclusion, being intentional about including all people. So diversity, equity, and inclusion, I think those 3 are fundamental, really, to the mission of the Alzheimer's Association and fundamental to public health, quite frankly. Here's a diagram that kind of shows this point. Equality, right? So every the apple is at a equal height for everyone, so it's there for everyone to get. No one's asking, saying that you should go get the other one. It's right there. But equity is giving people the resources that they need so that they can have access. Really, really important in that way to think about it. And I do think that a lot of the controversy around DEI, in places around the country relates to, why should we give people these extra resources, right? But we want everyone to have a fair and equal shot at health, right? That's what the apple would represent, is health, right? So giving people that access is so important. Well, level setting, I think all of you all know this, but dementia is a syndrome. It's an umbrella term used to describe symptoms associated with cognitive impairment. Alzheimer's and dementia represent 60 to 80% of all dementia, but it's not the only dementia, right? I think from a DEI perspective, it's important to point out that vascular dementia accounts for 10 to 40% of all dementias. We have Lewy body dementia, characterized by protein alpha-synuclein or frontotemporal dementia, which is characterized by impairment in the frontal lobes of the brain. But it's important to know that there are many dementias. Alzheimer's is the most common cause, but there are many. Vascular dementia represents, maybe 40% of all dementia. And then importantly, mixed dementia is prevalent, right? So none of this is just a static silo, but people have, many people have mixed dementia. And I would make a case that many Black African Americans or Hispanic Latinos, have vascular dementia in their cases of dementia. So really important to take home here is that there are a number of dementias from a DEI perspective. Really, really important to think of it like that. Well, why is this important? Why is Alzheimer's and other dementia important? Well, from our facts and figures, the Alzheimer's Association has releases an annual facts and figures report, and you can find it at alz.org. But this is a wonderful resource for all types of statistics related to Alzheimer's. You can see trends per state and all sorts of facts and figures. But this is important because this is a public health emergency. 1 in 3 older and older adults dies with Alzheimer's or another dementia. More than 6 million Americans are living with Alzheimer's right now. It's the 6th leading cause of death in the country. And we're always been talking about getting back in person, and we're still wearing masks and doing all that we can to keep ourselves safe. But we know that we observed a 17% increase in Alzheimer's and dementia deaths during the COVID period, right? So some of that's related to social isolation or people not being able to receive the support that they need, the care and support that they normally need. So really, really important to think of Alzheimer's and other dementia as a public health emergency. Here, more than 80% of Americans know little or are familiar with mild cognitive impairment, right? And so that's important because everyone who develops Alzheimer's or another dementia passes through what we call mild cognitive impairment, right? And so if you're able to get a diagnosis at the mild cognitive impairment stage, there may be things that doctors can do to slow that progression, right? So knowing the progression of the disease is so important, and more than 80% of Americans do little about it, right? So this is why we're out in communities. Our chapters are out. We have over 70 chapters around the country doing work to educate communities about Alzheimer's and other dementia. Well, it is a public health emergency. Our advocates, as a part of the Alzheimer's Association, we have the Alzheimer's Impact Movement. And this is just a very hard-working, wonderful group of advocates that rally and meet with policymakers about the need for more Alzheimer's funding. And so if you look here at 2011, there was $448 million at the federal level at NIH dedicated to what they call Alzheimer's and related dementia research, right? So Alzheimer's research. Now, $448 million would pay all my bills, and I can go around the world. And, you know, you hear from me, but I'd be on the other side of the world. It's a lot of money. But at NIH, you know, it pales in comparison to the budget of the National Cancer Institute or the Heart, Lung, and Blood Institute. So, you know, not a lot of money to fund research at NIH, my former employer, right? And so these advocates got together and they called their Congress, their representatives, and that has gone up to $3.1 billion in 2021, right? So plenty of opportunity for research. This is important, right? Because when NIH starts funding researchers, you get young researchers who just finished their Ph.D. to say, hey, I'm going to get into that Alzheimer's research, or mid-career researchers who would say, oh, I'm going to go where the money is and try to translate my research lab to be competitive because there's money over at the National Institute on Aging. So this has been tremendous to see the response to the public health emergency and the resources that are available. And so I would say the flagship result of this increase in funding is the Alzheimer's disease research centers, right? And so what NIH would do is take that money, fund academic institutions like the University of Maryland and Johns Hopkins or University of Michigan, where I went to graduate school, and then they have turned around and developed what they call Alzheimer's disease research centers, right? So these centers are housed at colleges and universities, academic institutions, and they're able to conduct Alzheimer's research from a local perspective, right? We're thinking of maybe socio-cultural variables that are important for Alzheimer's risk, a standard, labs that look at amyloid and tau, the hallmarks of Alzheimer's, but again, taking that money and diffusing it around the country, so there are centers all over the country is the wonderful result of the NIH budget going up to $3.9 billion for Alzheimer's research, right? That's one of the things I would like you to remember. From 2011, $440 million to 21, $3.9 billion for Alzheimer's research. So we're in a space where there's a lot of research going on. The product of that research is, for example, this treatment aducanumab. So we're in the era of treatment for Alzheimer's, right? Did you know that there was an FDA approved treatment for Alzheimer's? And there are actually two. So this first one, received conditional approval in June of 2021. And there was some disagreement in the field around its efficacy because there was some data that was added to the trial, and that received some criticism, but it has been approved by FDA. And then a second one called lecanemab, right? And that was approved by FDA just about a month ago, right? And what they do is they reduce the amyloid in the brain. Amyloid causes plaques in the brain, and Alzheimer's is characterized by plaques and tangles in the brain that disrupt memory. So, lecanemab and aducanumab, they're both antibodies, and they reduce amyloid. They're given by an infusion. And so two FDA-approved treatments. So we're in the treatment era. Now, can you just go out and access it tomorrow or today? Well, it's very costly because CMS is still considering, the Centers for Medicare and Medicaid Services, still considering whether they would cover it, right? So very expensive. Most Americans wouldn't be able to afford these FDA-approved treatments, which we think is, at the Alzheimer's Association, just unfortunate, right? And so we advocate for the immediate approval for coverage by CMS for these treatments, and for people to have access and to determine whether they're right for them. Really, really important. Cost should not be a prohibitive factor for accessing these treatments. So another thing I want you to take is that we're in the treatment phase. There are two treatments, FDA-approved treatments, but most people can't have access to them because they cost so much. Now, in these two trials, there was a severe lack of representation of African Americans and Hispanic Latinos in the trial. Okay, and so while from a DEI perspective, diversity, equity, inclusion perspective, we're excited about the scientific progress. We remain disappointed about the representation in the trials, right? Because we need to have a representation of African Americans and Latinos in the trials to make sure that these treatments are safe and effective in all people, right? So still work to do, but excited about the progress in science. Well, I'm going to shift gears here just a minute and talk a little bit about, your question is, well, did the African Americans want to participate, or the Hispanic Latinos want to participate, or were they still thinking about the Tuskegee syphilis study, or what's going on here, right? So in 2021, the Alzheimer's Association delivered a special report on race, ethnicity, and Alzheimer's in America, right? And you can also find that at alc.org. And a landmark report, because this is the first national report to really look at different racial and ethnic groups and their perceptions of accessing dementia care or their knowledge of Alzheimer's and dementia. So really important to take a look at this free of charge. You can go online and find this a really, really good report. And so this is what we did. We conducted 2 nationwide surveys of US adults and Alzheimer's caregivers, right? And this is the first time this has ever been done that included Asian American, Black, African American, Hispanic, Native, and White American. So, when we're thinking of, again, diversity, equity, and inclusion, there's so many variables and factors to consider, but we know race and ethnicity is important in this country because it decides where people live. Race and ethnicity is strongly correlated with socioeconomic status. So race and ethnicity is something to consider. Not the only variable to consider, but it's important to consider from an inclusion and representation perspective. And so in these surveys, we examine knowledge of the disease, access to care, trust in healthcare, and then maybe even the existence of discrimination, because if we can't talk about race, but talking about racism, right? Really important to put those two together. So, this was just a really interesting report. I'll get to the data in just a minute, but we did it because almost 2/3 of Americans with Alzheimer's are women. There are disparities in Alzheimer's and dementia, right? So women are disproportionately affected. Older Black or African Americans are 2 times more likely than whites to have Alzheimer's or another dementia, and Hispanic Latino Americans are 1.5 times more likely, right? So really important to think of the factors, that might be in play for why these disparities exist. If anyone have an idea of why women might be more likely to have Alzheimer's or another dementia than men?
We live longer.
Okay, that's one.
Stress. Yeah.
Could be stress. Could be factors, linked to reproduction. The answer is we don't know, right? And that's why that $3.9 billion needs to be dedicated to more disparities research. But some hypotheses could be around stress over the life course, or reproductive, or the lifespan. How about older Black or African Americans and Hispanic Latinos? Why would they be more at risk?
Access to information or healthcare.
Access, very good. Access to healthcare, right? Information, right? Quality healthcare and information, really, really important, right? So there's a constellation of factors, that could be at play here for why anybody would be, at risk for Alzheimer's and dementia. And then there may be a few that are unique to, in this case, Black and Hispanic Americans that we really have to focus in on, right? And that's the equity, right? There's the risk for everyone. And then what are the factors that are unique for these groups that we really need to consider to get them to an equal access to healthcare and information, right? Okay. So the good news is that the Lancet Commission and all these factors that could be fundamental or unique, they released a report in 2021 that said, and the Lancet Commission is a group of scientists, from all over the world, smart people sitting around a table, reviewing, the scientific literature, and they came out, they said, in the report that 35% of global dementia may be preventable. Now the P word is big, right? Preventable, right? So 35% might be, global dementia is preventable. And so, that's intriguing because in my community where I grew up outside of Atlanta, Georgia, we all thought that there was nothing you could do to diminish your risk for Alzheimer's. So it was either genetic, you're gonna get it or you're not gonna get it, and it was just a luck of the draw, right? And so in their review of research from all over the world, they identified what they call modifiable risk factors. So think about the disparities. I said the constellation of factors and some that are unique, right? Well, they said, well, hey, these are the modifiable risk factors that you've got to pay attention to, right? And so those factors included education in early life, really important, hearing loss in midlife, hypertension, obesity. Remember the different types of dementia that we're talking about. Smoking, depression, physical inactivity, social isolation, and diabetes, right? Now, if you remember the types of dementia that we spoke of, what some of those factors relate to which dementia? What was the second most common dementia? Vascular dementia, right? Right. So, and we said that mixed dementia is also prevalent, right? So people have Alzheimer's and maybe sometimes vascular dementia, right? So the key here is that there are things that people can do to reduce their risk, right? Because the P word is pretty big. Preventable, is a big word, but I use the phrase risk reduction, right? And it means that over your life course, there's things that you can do, which means certainly keeping your hypertension in order, obesity, no smoking, right? Get your physical activity in, and then if unfortunately people develop diabetes, they manage their diabetes, right? So that their vascular health is in order, right? Really, really important to think of it that way. Now, I know when I talked about the disparities, you said, well, maybe some of these groups are just genetically, predisposed. They're supposed to have, and there is a genetic risk for Alzheimer's, but the research is telling us more and more, and this is some research that was presented at our Alzheimer's Association International Conference, that it's not the genetics that explain the disparities. It's more social and economic factors that we got to pay very close attention to. So it's not the genetic factor that explains the disparities. Here's a study that's really important. So the Sprint Mind study was the first to demonstrate a reduction of new cases of cognitive impairment. And remember what we said about mild cognitive impairment? Everybody who develops dementia passes through mild cognitive impairment, right? So if you get a chance to, get people diagnosed and treated at the mild cognitive impairment phase, you would reduce the number of people who go on to develop dementia, right? So it's important to intervene at that very specific phase of the disease. And so the Sprint Mind study showed that getting people blood pressure in order to 120 systolic had a reduction in risk for mild cognitive impairment. So first, people would never even get the mild cognitive impairment if they got their blood pressure in order. A 17% reduction of dementia and a 15% reduction for both MCI and dementia, right? So it speaks again to these modifiable risk factors and keeping your cardiovascular, your vascular health in order, in optimal shape over the life course. Really, really important. The Alzheimer's Association is taking these findings and studying them in more detail to really get a sense of, the recipe between lifestyle factors, things like diet, what kind of diet. We know diets, low in saturated fat, low in red meat and sugar, high in fruits and vegetables are the best diets. But what does that mean for brain health and physical activity? What type of physical activity? So if you get a chance, look up U.S. Pointer trial. We're actively recruiting and analyzing data right now about that particular recipe. I mentioned that just a minute ago. So that's at the individual level, right? So we talked a little bit about this constellation of factors, some that could be unique for those that are most at risk. So we just talked about what people can do. Now there's the social stuff, right? That we mentioned, just access to resources, right? And so there has been research that showed that people who were, in this case, Al Hazori and her colleagues at Columbia, showed that people who were higher SES, social economic status, which is a combination of occupational status, education, and income, right? So that's socioeconomic status, which essentially means that you have access to resources for a number of things, right? And so this research showed that those who were higher SES in this particular study, which had a high representation of Hispanic Latinos, stayed dementia-free the longest over their life course, right? So, what is it about SES and dementia? Is, in my mind, it is having access to information and awareness, or having access to doctors and being able to talk to people to say, oh, you go see Dr. Jackson, and they'll see you right away. And if you're not in that network, you just don't know. And then you can go to Dr. Jackson, and you have the money to actually pay, right? Because SES means you got high income. So really important thing of the social part of this, which is really important. And then there's something I think that's unique, and it's the equity piece. So if we look at heart disease death rates between 93 and 2001, right? And so we're looking at heart disease death rates, and we're looking at the Black-white comparison, okay? Now, education, we just mentioned, was a part of SES. And so as years of education increase, health is supposed to do it. Increase, right? Your health, right, okay. Now, so remember, ratio, from your stats class in high school, 1 equals, it means it's equal. Okay, you're comparing two groups, and the ratio of 1 is equal. Okay. Now, so as years of education increase, let me back up one other thing. And heart disease death is important to which type of dementia? Vascular dementia, right? Because many of the risk factors for vascular dementia are relevant for heart disease death rates, right? Okay, so this is relevant for our discussion. So in this, as years of education increase, the Black-white ratio for women and men in heart disease death rates is supposed to do what? Get closer to what?
1.
Get closer to 1. It's supposed to be equal, because education is supposed to be an equalizer. But here, the heart disease, the ratio for both women and men actually increases. What is that about? So the more education, somebody like me, I went on and I've been in school my whole life, right? You would think that my health, is supposed to be protected, and I would look more like, in this case, a white man with the same degree and the same, all this kind of stuff, right? But what could be different?
Not acting on that education.
Not so back to the individual, okay.
Yeah.
Still doing some of the same stuff. Okay, all right.
Still limited access.
Still limited access. Yes, still, right? Yeah. Okay. Well, I had to take these Black history books. I take it back to W.E.B. Du Bois, and I think this is relevant for the work that we're considering in Alzheimer's and dementia. And he said, in his time, he was discovering crime. He was researching crime in the United States. He said, well, the appearance of crime among Blacks is a symptom of wrong social conditions. So not just SES, but a stress of life, right? And see, there's something about being Black in the United States that, presents a unique stress that people have to deal with, right? And so when you go back here, the realization that I would have been in school for all these years and I don't get the return, on that investment could be so stressful that it has implications for how I cope. I might turn to substances and poor diet, or it just may have a direct effect on my insulin, my cortisone level every day, just angry, right? So it's something about, Du Bois said, the stress of life, and I go back to that special report, that we commissioned in 2021, and we found that more than 1/3 of Black Americans and nearly 1/5 of Hispanic and Asian Americans as well believe that discrimination would be a barrier to receiving Alzheimer's care. Now this is deep, right? Because what we just said was everyone who develops dementia passes through mild cognitive impairment. So if you can get a diagnosis, right, a timely diagnosis, there could be things that the doctor can do to slow that decline, right? Getting your blood pressure in order. We're in the era of treatment, right? So if you get diagnosed with mild cognitive impairment, if CMS ever decides to approve to cover this treatment, people can get the treatment to slow the decline. So getting to the doctor, knowing when to get to a doctor is so important. In our survey, we found that the people most likely to have Alzheimer's or another dementia believe they would be treated unfairly because of their race, color, or ethnicity, right?
Yeah.
Really interesting. That gets into that space of what Du Bois was talking about. W.E.B. Du Bois, he says, the stress of life that in this case, said, I don't even want to go to the doctor because I'll be mistreated. Half of Black Americans actually reported, because this is a perception, right? This is saying, I think I might be treated unfairly. This is, half of Black Americans said, well, I have been. When I went to the doctor, they didn't listen to me. I felt like I didn't belong, I wasn't heard, right? And so, there's some things that we have got to do around cultural, not just, maybe not competency, but humility, making sure that providers, neurologists, dementia care specialists, geriatricians provide care with a humility that makes sure that people feel like they belong, right? Particularly people who come, from other, race, ethnic groups that are different than theirs, right? And so here, we talked about the $3.9 billion that NIH has for Alzheimer's research, came up for $440 million, right? We're in a landmark time. Nearly 2/3 of Black Americans believe that medical research is biased against people of color. So the NIH is supported by all of us. It's tax dollars, right? We all pay for that agency to spend this research money. And our survey, people don't believe that it's even relevant to them, right? Really, it's interesting stuff. And here, only half of Black Americans, that's considerably lower than everybody else, trust that a future cure for Alzheimer's will be shared equally, regardless of race, color, or ethnicity, right? So that says something, because this data may be real or not, but the perception is that it's not relevant for me. Now, none of the stuff that's happening is relevant for me, and the work that we have to do is to assure communities that it is, right? We have to get out in communities and share this information. And that is why our 75 chapters are doing all that we can. We've got so much work to do. We're doing all that we can to get this information about these treatments, the lifestyle factors. I mean, just being able to get, my grandmother who passed of dementia 2 years ago, to get her, active and moving from an exercise or physical activity perspective, would have been tremendous at the right time, because she had vascular dementia. But none of us knew, not even me at that time, we're saying 10 years ago, that was even possible, right? And so the research is telling us more and more what's good for the heart is good for the brain. We need everyone to tell everyone else, that's important as well. And so here's another factor, I was talking about the constellation of factors that are relevant for disparities in Alzheimer's, and which ones might relate to equity, right? And so discrimination, I think we would agree, the perception or reality, of racism and discrimination is one that's in that equity bucket. Here's another one, I think, and that is just being a part of the research studies, right? So we want to address the disparities. We have to include African Americans and Hispanic Latinos into the clinical trial so that we can understand how these factors influence them differently or the same. But unfortunately, less than 5% of Alzheimer's and dementia clinical trial participants are African American, Hispanic Latino, Asian American, or American Indian Alaska Native, right? So essentially, all of the trial participants are white. And so our assurance of these treatments in non-white populations is pretty low, right?
Mhm.
Right. To me, this is a bioethics issue, and it relates to not only the researchers who could do a better job of recruiting in these communities, but also the funders like NIH and the Alzheimer's Association to hold researchers accountable, and the FDA. FDA shouldn't approve these treatments if they don't have the representation and insurance that we need, right? So this is across the board. But again, we said was equity, some of the factors that relate to equity, discrimination, and then inclusion, I think, into the trials. That's fundamental, really, really, really important. Well, to address this, the Alzheimer's Association drafted the Equity in Neuroscience and Clinical Trials, Alzheimer's Clinical Trials Act. Without going into too much detail, this is going to add resources to those Alzheimer's centers that I mentioned earlier, research centers around the country. They're going to get money, resources to do better engagement into underrepresented communities. And not only money, which I think is critical, but accountability, right? Because when you're a researcher, you receive a grant and you get money to do the community engagement. Your program officer, I was one for many years, is going to ask you, hey, what did you do with the money? How did you spend that? What are the outcomes? And that's so important. So I won't go into that. This is all stuff that ENACT will provide. It was included in this year's omnibus, this year's budget, federal budget. So we're really excited about the accountability that it's going to create for researchers. So as I begin to end here, here's a call to action. More multi-level health disparities research, focus not just on lifestyle, what people can do, that is important, but also some of the social stuff, especially racism and discrimination, in society, really important. Increase diversity in health systems and health-related institutions. Now, we want to enhance cultural humility, cultural competence. All that's important. Standards for cultural competence. But wow, it would mean a lot if I took my grandmother to the doctor, to the neurologist, and she saw someone from her community. She saw a Black African American, or people saw someone that represented them, right? Now that's a pipeline issue, right? Because there just aren't many neurologists that come from the African American, Hispanic, Latino communities. So we've got to invest in training students to go into these fields, mentoring them. That's a long-term call to action, but one we've got to pay very close attention to. And then what we're doing is, what we call participatory engagement to build trust in agency and communities. And I mentioned that we have over 70 chapters around the country. They're using principles of community-based participatory research, which is seeking national partners. We're the Alzheimer's Association. We've got free resources. We're in it for the right reasons. But there's a history of mistrust, right? And in some of these communities, we have not been as inclusive as we needed to be in the past, and people remember that, right? And so the best way to really address that is to think of collaborative partnership. Getting back to how I started this presentation, that is, we're not able to do all the things we want to do without trusted partners, right? And so working with organizations, we're able to build mutual respect, really share our power. We got all kinds of marketing capabilities and PowerPoint presentations and information about Alzheimer's and dementia. But if we don't get it to the people who need it, it's not being served well, right? So all of this, shared knowledge and reflection on the past, mutual benefit, it really relates to trust, how we can trust each other to do the work that really needs to be done. Here's some examples of a slide that shows our national partners. You see the National Black Nurses Association, National Hispanic Medical Association, all these national partners, one fraternity, Omega Psi Phi fraternity. Some are related to health, some are trusted entities in the community. And we train them to give this kind of presentation and go talk to their parishioners in the church. We partner with the African Methodist Episcopal Church. We're really important. I talked a little bit about that partnership. AME is one of the largest Methodist denominations in the world, probably the largest Black church in the United States, headquartered in Nashville. They've been about public health and equity since the beginning. And so we have worked with the AME Church now for 4 years. And it has really taken us some time to do all of these things, because they're not going to just let us, run loose in their churches without, understanding, knowing that we're in it for the right reasons and that they can trust us, right? So it has taken 3 years just to do this, right? And people need the information, but we hope and we trust that once we continue to get to that place of working together well, we'll deliver this information in a much better way than us simply calling people or sending stuff in the mail, right? Again, get into equity and equality. Equity means we got to do it together with trusted organizations, right? Really important. And so we've done all kinds of things. I mean, the AME Church has a global membership of 2.5 million, right? So can you imagine if we're able to really work with them to get our resources about these FDA-approved treatments, or knowing what's good for the heart is good for the brain, telling people, or getting the word out about participating in the clinical trial, the trials that are in their area, bringing someone to a panel session to say, hey, Mrs. Jackson participated in the trial, and this is how she benefited. She was able to see a doctor, get her blood pressure under control, diabetes managed, access to novel treatments before they even approved by FDA. So participating in a trial is a really important step in all of this, but we've got to trust that no one will be treated like Henrietta Lacks in Baltimore or the Tuskegee syphilis study. People need to know the new protections that are in place. Really, really important. This kind of some of the stuff we've done with the AME Church. We had a connectional Purple Sunday. We were talking, Melissa and I were talking about, coming back from Zoom duty on COVID, and trying to get that in place. But we were on Zoom in 2022, and we had a connectional Purple Sunday, which meant that we had churches all over the country participate in this webinar. And we had over 4,000 attendees, hearing about the different types of dementia, the importance of clinical trials, what's good for the heart, good for the brain. And we looked to double that in 23, right? Because now we're working better together. This is the power of partnership, really, really important. So as I end, we developed a treatment by 2025 that delays the onset of Alzheimer's by just 5 years, right? And we got 2 FDA-approved treatments that may not do this, but let's just say we did 5 years. So someone gets diagnosed with mild cognitive impairment, and it delays by 5 years, then the next step to mild dementia. 5.7 million people expected to develop Alzheimer's in 2050 would not. But the number of people that we can influence if we continue to and treatment here is not only a drug, it is a recipe of lifestyle intervention, or giving people support so that they can sustain a healthy lifestyle. All that is important, right? And so a treatment that would be tremendous. Health equity is when everyone has a chance to be in that 5.7 million number. They're not disregarded or kept out of that because of their race, ethnicity, where they live, any of that. You know, they understand how to get people the resources they need so they can get into that 5.7 million people. That's the take home of what we do. And to be able to do that, we've got to focus on partnerships and understanding the unique pathways to dementia risk, care, and support. The unique, some people are experiencing discrimination in the dementia care system. Some people are not even in the tribes. Some people don't know the difference between Alzheimer's and dementia. We've got to understand how to get people the resources they need so they can be in that, they can be in that number. Here's a call to action that I mentioned before: more multi-level health disparity research, more representation in health centers and health systems, cultural competence and humility, and then getting in the community. The Alzheimer's Association is one of the few nonprofits in the health sector that's staying in community. We've got so much more to do. Are we doing everything that we should or could? No. Are we committed to staying in the community, finding out who to work with so that we can? Yes, right? So we're looking for partners to help us. Just before the Super Bowl, as an example, we had a conference focused on Black men's brain health. I mean, who focuses on Black men in this country in public health? Not many. You know, so we had this in collaboration and partnership with the NFL Alumni Association, the NIH. They got $3.9 billion. You know, workplace social welfare, these other partners. We all came together to focus for 2 days on the brain health and the lifestyle that we talked about, and discrimination and how it relates to representation, you know, of Black men's scientific research. So we had a wonderful discussion there. And then, we've gotten a little creative and getting this information out to communities with a stage play. It's called Unforgettable. And so we partnered with Gary Davis Productions, and amazingly, I'm one of the executive producers. I never thought I'd get into the arts in this way, but it's an amazing stage play where the actors are covering the 10 warning signs for Alzheimer's, or how to be in touch with the association, or what's good for the heart is good for the brain, in a format which we call edutainment, right? And we had 2 shows just this past weekend, one in Dallas with over 1,200 people to attend, primarily Black African American audiences. And then the next day, on Sunday in Houston, we had over 500 people attend a stage play. And the mayor of Houston and Sheila Jackson Lee, the representative from Texas, attended the play, right? And so, the point here is that we're looking for different ways to get the information to the community, and not just Dr. Hill standing up giving a lecture. Some people, stay awake for an entire lecture, but they all stay awake and laugh, when Gary and the cast are doing their thing in the community. So again, equity, thinking out of the box about how to get the information to people in a way that. And so that last slide here, just going back to that, power of partnership. I tell you, everybody here graduated, and there are over 20 Masters in Public Health programs at HBCUs around the country. One at Howard, Morgan State, Delaware State. So, just people getting together, deciding that they're going to do something at a community local level, could change the world, could change public health, could change status quo as we know it. We all went on to earn doctorates in public health. All of the students went on to become leaders in health equity. And it was because the power of people who came together to make a change. I believe that we're going to change it. We're going to move the needle on representation in clinical trials, and we're going to get the information to people who need it if we just keep pushing and looking for ways to work together and partner. And so with that, I will end it, but I'll end it on the final slide. Because partnership is so important, and from the beginning. So this is Dr. Alois Alzheimer, right? He was the first researcher who challenged the notion that some of the behaviors that he noticed among older adults was solely due to what they call senility at the time, or old age in the early 1900s. So he challenged, he said, something else going on, in the brain that we've got to understand. And he compiled some of the, greatest and maybe most hungry researchers from around the world to join his lab, right? And he recruited a young African-American, Dr. Solomon Carter Fuller, who was born in Liberia. His parents were from Virginia, but they moved over to Liberia. So he was born in Liberia. And when it was time for him to go to college, he moved back to the United States and he enrolled in Livingstone College, which is in North Carolina. It's an HBCU, still open today, right? From there, he went on to be the first graduate of Boston University Medical School. And because of the racial discrimination of the time, he couldn't pursue the research career that he was really interested in. He couldn't have his own lab, probably couldn't get a grant from NIH. So he became really good at performing autopsies at a hospital in Boston. So good that Dr. Alzheimer's heard about, Lois Alzheimer's heard about, and recruited him to his laboratory in Germany to help him identify what we know now as the plaques and tangles that characterize Alzheimer's, right? So from the very beginning, African Americans have been a part of the discovery, the fight, the race for a cure for Alzheimer's. And again, I believe that our partnerships will continue to advance scientific progress and most importantly, our pursuit of health equity in this country. So with that, I'm done. Thank you.
Thank you, Dr. Hill. Just a reminder, Insight brings specialized care, support, and education to our caregivers or individuals with dementia and our community. Feel free to go on our website. You can see upcoming events. We're going to continue this collaboration and partnership with them to be bringing other things. I do have an author spotlight in April with a wonderful author who is African-American, who wrote a book about being a caregiver, taking care of both her mother and now her husband. And she's going to be guest speaking for us with her book as well. So keep an eye out on our schedule because we're not done. This is the first step to being out there and collaborating to making sure everyone is heard and we get the information out there.
Great.
So thank you.
Thank you.
Can I ask you a question?
Sure.
So, how do you get that information?